actually Bella that did it.
Oh, really? Tell me when you're ready.
Ready to go.
Okay. Hello, everyone.
Now you're going to chat to me.
Yes.
Do you want me to move near the camera?
She's chatting to you?
Yeah.
Oh. Okay. Hold on.
You can move near me.
We're making an actual video of this if you're wondering why we're having such a production, because then it will just
We're taping literally everything.
available on YouTube.
Okay, we're good.
Okay, ready?
Yeah.
Hello, everyone. For those of you who don't know me, my name is Dr. Suzanne Humphries. I'm a medical doctor, internal medicine specialist. And I'm also the co-author of Dissolving Illusions and the author of Rising from the Dead.
Okay, actually, do you know what? Actually, you should put, if you're going to do it like that, you probably should do it straight into that camera. Because you're talking.
Yeah, let's do that.
Yeah. We're
you get to see production here. Yeah, do it over.
Yeah. Sorry, Susan. I didn't realise. Now that you've done it, I realise you're right.
Okay.
Observe.
Go for it.
Good? Okay. Hello, everyone. For those of you who don't know me, my name is Dr. Suzanne Humphries. I am an internal medicine specialist and co-author of Dissolving Illusions and author of my recent book, Rising from the Dead. I started studying more holistic forms of medicine back around 2008, and one of the things that I've really studied and started to use in my practice and in my life and on my family and friends is vitamin C. And I'm not going to get into a discussion today about natural versus synthetic. Today, I'm only going to be talking about synthetic vitamin C and the benefits that I have seen in my own life, in my practice, and with my family. I want to tell you the forms of vitamin C that I recommend people keep on hand and some of the routes of ingestion and use and when to use them. And I'm going to give you some demonstrations because some people have problems with certain forms of the vitamin C. So I think one of the most useful ones is this one here. This is Nutribiotic Sodium Ascorbate, okay? They also sell an ascorbic acid, which can also be useful, but it's much more acidic, so it doesn't necessarily sit well in some people's stomachs. Sodium ascorbate is buffered. It does have a small amount of sodium in it. It will not make you toxic from sodium in the doses that I recommend. The price of this 16 ounce is $18.37 on Amazon. You can also get it on iHerb. You can get a 2.2 pound for $37.87. Okay? So I recommend that everybody keeps some of this in their household. I don't get any kickbacks from this, nothing like that. I don't even know the people that make this. I'm comfortable with this brand because it's non-GMO and because I use it so often. I like this brand. This is a newer form of vitamin C that I discovered at the Reardon Clinic this year when I was there for a vitamin C talk. It's called Sufficient C. The reason I like this is actually ascorbic acid, but it's very flavorful and it's easy to get kids to drink it, and frankly, I like to put it in my drinks as well. This you can get, let's see, this is a 250 gram jar, which will make about 30 liters. And this is $39.99 on the Sufficient C website, and it's $37.99 on Amazon. You can get a jar half this size for $22.99 on their website and $21.84 on Amazon. I recommend, if you're going to use this, that it's a way to get your kids to take this as well. So if you mix some sodium ascorbate in with the Sufficient C, you're going to be able to get a dose that's going to be much more powerful with half the hassle. So those are those two forms. And, I recommend that you experiment on your own. It's best not to ask me what's best for you. It's best for you to discover what's best for you. This is another form that I recommend you keep in the house. Always have at least half a box on hand in your house. This is called Live On Labs Lipospheric Vitamin C. And yes, there are many other types of lipospheric, but in my opinion and in my experience, I don't trust how liposomed they necessarily are. You don't want to put these in the blender because it'll break up the liposomes. You'll still get the vitamin C, but you won't get the liposomes. So it basically comes in sachets. You get 30 in a box. This is a little more expensive, so I tend to use it more sparingly. $29.95 for a 30 pack, and it's available from Amazon and Live On Labs. And if you're a healthcare practitioner, you can talk to these companies. They will all give you discount for large orders. So this here now, I'll just show you how I take it because the taste doesn't bother me one little bit. Like Polly will gag when I do this. So I'll basically just open this up. I travel a lot, so this is really good to put in your briefcase. Keep one pack in your purse if you feel a little something funky happening in your throat. And I just squeeze it right into my mouth. Like that. I swish it around my gums because I've had, if anyone's read my autobiography, I've had all kinds of gum and facial surgeries and problems. So I like that. It feels good to me. If you are grossed out by what I just did, let me show you something that my dear nephews discovered. I don't know if you can see this Jonathan Tommy unique table that he made here, but I have all my stuff sitting on here. So if you're grossed out by doing what I just did, what you do is you take the pack and you empty it out into the bottom of an empty jar, or an empty glass rather. And then what I have here, Jonathan basically blended up an orange. You know, I would juice the orange, but you can blend it up. I recommend using fresh oranges. If you all don't know this, even concentrated orange juice and the orange juice that you'll buy in the stores, the different brands, they basically have to evaporate it and it removes all the flavor out of it, and then they have to put flavor back in. It's disgusting. So then I'll just put a little bit of that in there. Then you take a straw and you put the straw on the bottom and then you slurp it up and into the back of your throat. Then you won't taste anything.
Can you stir it first? Oh man, I still couldn't do that.
I didn't know you could.
If you did that, you wouldn't even taste it. I taste nothing but orange right now. Okay? So that's a way to get kids to take liposomal vitamin C if you need to. The other way is to just take one and put it in a shot glass, a little orange on top, down the hatch. As you notice, I just took 2 packs of it. It was 2,000 milligrams that I just took. It's liposome, so it probably goes a little farther in my body. You can probably hear my voice isn't normal because I let my immune system get very beat up traveling in the past week, and I got wicked sick for about 3 days, high fevers, and then I just got over it. It was amazing, actually, how fast I got over it. So when did you pick the different forms of vitamin C? And that's really what I want to talk to you about. And I also want to refer you to a video that I did in Sweden. It's on a Vimeo page, and it's on, I can't put it on my own YouTube page, but it's a longer talk that I did which describes the physiology of vitamin C, why we need it, what it actually does in the body, how to dose it, and why I say that synthetic vitamin C is perfectly fine and useful. I also did another version of that in a New Zealand video, which is available on my YouTube page. Okay, so lipospheric vitamin C will start to be absorbed in your mouth, in your esophagus, in the back of your throat. So it gets absorbed very readily and rapidly because of the phenomenon of like dissolving like. It's basically got like a fatty acid component on the outside, so it gets brought into your cells without requiring a transporter to bring it in. The downside is that it won't necessarily make it to your colon where you may want to get vitamin C levels. But it's still fine. I will use this in newborn babies, very young babies, because you can basically just take your finger, swab it into the inside of the cheek, just in little bits at a time, and give them doses that are easy to administer. And I also take a pack of it after I brush my teeth and let it get all into my gums. I had more oral surgery this summer, and I use this stuff like it was going out of style, and it really helps with wound healing. I had a little girl who was mauled by an animal, and after she developed scabs over the areas and they were no longer tender, her mom started putting this on because it will get absorbed through skin as well. So there are lots of uses for this. It is a little bit more expensive. I generally, if somebody's sick, having a flu or infection, I'll use a combination of these two. And this is kind of, you know, what I use for kind of everyday, just flavoring and getting a little bit of extra, but you can add these two together, which also is really nice. You know, even if you're getting intravenous vitamin C, you still need to be taking, and even Dr. Tom Levy, who wrote one of the best books on vitamin C called Primal Panacea, he talks about how, you know, IV vitamin C is out of your body in 6 hours. So while you might get this great burst of huge high levels in your bloodstream, once you go home and after a few hours, it's done. So if you want to continue to have levels in your blood, and especially when you just have the common cold, like this stuff every 3 to 4 hours will keep steady levels, because basically after 4 hours an oral dose will be gone. And I go through that with showing the charts on my video. So this form here is kind of like the cheap and dirty kind that I just carry around with me. I put it in a small vial wherever I go. I take this with me. It's very inexpensive. It's very useful. So you can take this orally. You can gargle with it if you've got a sore throat. It's amazing. Just put, a teaspoonful, half a teaspoonful if you're an adult, half a teaspoon to a teaspoon if you're a child. You want to use smaller doses into some water, not burning hot, but, a little more than lukewarm. And just start gargling with it. Hold it in as long as you can and then swallow it. And it's really helpful because you're getting the sodium ascorbate right into where it needs to go. I will actually make a paste out of this and use it topically on staph infections and wounds. You can add it to your toothpaste if you want to give a little extra into your mouth. So there's just really, you can't go wrong with this form of vitamin C. And this is the primary form that I recommend for any child who is beyond exclusive breastfeeding and having whooping cough or any other infection, is that they're going to need some of this. You can, if you take too much of this, you'll have a bout of diarrhea, and it will basically just be like one flush. It's not going to make you keep going all day long to the point that you get dehydrated. But I will say there's the caveat, and you should need to watch my video because I talk about kidney stones and I talk about dehydration and glucose 6-phosphate dehydrogenase deficiency. You need to understand those things. But you don't want to necessarily give this to anyone who is dehydrated. Always hydrate first before you start taking any form of vitamin C. It's just a smart thing to do to make sure that nothing goes wrong with the kidneys or oxalate buildup or anything like that. So hydration first, unless you're in intensive care where there are studies that show that it saves lives in sepsis, even if you've got liver failure and kidney failure. So there's the ascorbic acid form of this. If you've got someone in the family that has acne or skin problems, what you can do is basically take 1 teaspoon of that into 100 mLs of water in a spray bottle made fresh every day. Spray it on the face, spray it on the neck. If there's any skin problems, spray it on there. Go to bed or go sit out in the sun for maybe like 10 minutes. Let it dry up. It's going to be a little powdery. It can turn the sheets orange, so just beware of that. It's very helpful for skin. And one day this week we'll talk about skin immunity because it's really interesting. The skin actually has an amazing immune system of its own, which acid forms of vitamin C, like ascorbic acid, work with, because that's how the skin functions optimally. The skin immune system functions optimally at a more acid pH. Let me just look at some of my notes that I have here. So with the ascorbic acid or sodium ascorbate, you can make a paste and put it on. What I do sometimes if my skin is acting up is I'll just make a paste of it and just smear it on and just go to sleep. And I just use a pillowcase that's not white. Or you can do the spray that I just talked about. The liposomal you can use on the skin, you can use it on the mouth and gums directly. And gargling I talked about, drinking I talked about. And so in general, if someone is sick, I recommend that they take this perhaps every hour. You have to figure out the dose that you're going to take, but anywhere between 1/4 teaspoon to a teaspoon every hour in anyone that's over maybe 60 pounds. Younger kids, you have to dose smaller and keep a close eye. And then when you feel the belly gurgling, you know that you're having an effect, and that's good actually. I like to keep patients having 2 loose bowel movements per day when they're sick when I'm dosing with this, with frequent dosing, and that's the key, is if it's a small child, every 15 to 30 minutes dosing, older kids and adults, every hour to 2 hours, to get 2 loose bowel movements per day. Now, the last thing I want to show you is something that I've been a bit shy about talking about in public, but I've gotten a lot of experience now, so I'm feeling, more comfortable about talking about it, is that the sodium ascorbate, I'm very clear, the sodium ascorbate, the buffered sodium ascorbate, this brand, I've never tried another brand, not ascorbic acid, not ascorbic acid, not ascorbic acid. Sodium ascorbate is what we're going to do this with. Anyone who has headache problems or sinus problems, what you can do is take a pinch of this and snort it directly up your nose. Now let me tell you, for years I've been using neti pots. Neti pots have never helped me in that sense. I don't think there's anything wrong with them necessarily, but it's never helped with my sinus, never helped with my patients necessarily, or with headaches. I've had so much overwhelming positive feedback for people who finally got sick enough and just resorted to trying to snort this. 100% of people come back to me and say, I can't believe it. That it clears out the sinuses, it gets the mucus production going, the headaches go away. It's really a great thing to do. So I'm going to demonstrate to you how I do that, and then you can, the youngest person I've done this with has been 11 years old. It was a young girl who is a friend, one of my friend's daughters. We were sitting there talking. She came in, you know, just doing basically like that. The cheeks were red and puffy, and she said her nose was really blocked, and I said, well, let's snort some sodium ascorbate. I'll do it with you. We did it together, and it was miraculous within an hour. It wasn't completely cleared, but it was very much better from where it was, and her facial redness went down. Now, I want to tell you why I don't feel bad about recommending this. As a medical doctor, as a nephrologist, you know, we do some of the most toxic things to patients. We use alkylating agents, we use chemotherapy, we use steroids, we use all kinds of things that I know are going to have negative effects on the body. Putting this straight into the nose, some people will say, oh, the osmotic pressure is too high, oh, you're going to cause nasal, you know, erosions. If you have a known nasal erosion or a known problem in your nose, don't do this, okay? Common sense has to come into play. But otherwise, besides that, it is safe to do once or twice a day for a couple of days in a row. I don't recommend doing this every day. And you'll get a feel for doing it yourself. And you can hear that my sinuses are still a little gluey. I feel fine, but I still feel a little gluey in my sinuses, so this really helps. So I think I've given all the cautionary discussion on this. So what I do is I just take a little bit into my palm. You can see there, that's probably even a little bit too much. And what I'm going to do is I'm going to take a pinch between my fingers, which is going to turn out to be about that much, see? So I'm going to lie on the table and show you how I do this.
Oh my goodness. Is it addictive, this? I mean,
no, not at all. I mean, I've had so many people do this, including some people on the VAX team, and it definitely helps. If you have a chronic problem, you're going to need to do it more than once. But with a migraine or a headache, it's going to be very effective. If your sinuses are blocked, you can still do it, because I'm going to show you that you actually can just drop it right into your nose. I used to do it sitting up, but I find that lying flat, you get a much better dose into the nose. So I'm basically going to take the pinch between my fingers, I'm going to lie down, and I'm just going to sit here like this and go. I just took that whole pinch in my right nostril. It burns a little.
And you just snorted it up your nose?
Yeah, and I have another pinch here. And I just kind of wait. It burns a little bit, but you have to know that my mucous membranes are very inflamed right now because of me just being sick and all the irritation. But it's by no means like, it's not bad at all. So basically, you do that, you sit up, and then there's a little bit left in my hand, and I'll just take that and let it get into my gums, and then have a drink of water, and then you just wait. And what's going to happen after about a minute? Are people freaking out?
No,
no.
That is fascinating.
So after a minute, there will be the mucus will start to come through the mucous membranes. And this morning, I basically had an inability to move anything through my right nostril. And the first thing I did that, and then all of a sudden the whole thing opened up, and it was a done deal. So then I'll just start blowing my nose. I like to hold it in as long as possible, like the snot and the sodium ascorbate. And then you just basically get like Niagara Falls, and then everything just opens up and clears out.
Okay, so go back. So you snort it up your nose, and then you sit there and you wait. And
I'm just still waiting. And it doesn't hurt. Like it doesn't hurt.
Could you say again what you're waiting for? Just a minute.
I'm letting it take action. So I'm basically giving it time to pull some of the mucus through, some of the, and decongest me.
And then
it shrinks the mucous membranes, and it draws fluid out.
And then you're going to get a tissue and blow it.
I'm just going to get a tissue and blow. Yeah. And this works really great. So I don't recommend doing this to your 5-year-old or to your 6-year-old. It's got to be somebody that's able to do it to themselves, that understands what's going to happen, that knows it's going to be a little bit burning. Start out with just a little bit so you can see what it feels like. Don't get brave and use a straw. I have a friend who asked her husband to do it to see what it would be like, and he took basically like a line of it, and then he started running around the house screaming, because that will hurt. You only want to just do that little pinch and just wait.
So we're all going to be sodium ascorbate snorters.
Yeah, sodium ascorbate. So any chronic sinusitis, I got Tom Levy to do this. I had all these doctors at the Reardon Clinic doing it, snorting sodium ascorbate with me, and they all said, wow, yeah, I can see how that helps.
Are you ready for questions?
Okay.
A couple of very, very basic questions. Number one, why do we even need extra vitamin C?
You don't need extra vitamin C, and that's why I want you to watch my video, because I describe all this. I describe what animals in the wild who don't make their own end up eating. I describe what animals in the wild synthesize themselves. It's about 30 milligrams per kilogram, 30 milligrams of vitamin C per kilogram per day is what the average mammal needs. And if you're getting that in your food and you're a healthy person, you're not a smoker, you don't have anything consuming vitamin C in your body, then you don't need to take any supplements. And in fact, when I'm healthy, I don't take vitamin C supplements, but when I'm traveling, you bet I've got this with me all the time.
Where do people go to watch your videos?
Well, the Vimeo video, just Google Suzanne Humphries. I think that was in Stockholm, Sweden, Swedish Orthomolecular Society. That video will come up. The one from New Zealand, which doesn't have the exact same information, you might want to watch both of them. That one's available on my YouTube channel.
Can we put any of these on Wheel of Wax, or is that not?
Yeah, you can take all. I tell everyone,
We should
download
have a
my
special
videos.
Suzanne Humphries
Playlist.
playlist. Yeah, well, I knew we'll get on that.
Take my videos. Do anything you want with them. It's all about getting the information out. Believe me, because nobody's getting rich off of this. It's basically we're going to put the
That's for
pharmaceutical
sure.
companies to
That's
have
for sure.
fake sales. That's the idea here.
And also pregnancy. Is it safe during pregnancy?
I've challenged somebody to find me the data that shows that vitamin C during pregnancy causes miscarriages, because that's what everyone's afraid of. All I see in people that are pregnant taking between 500 milligrams to 6,000 milligrams per day. It's up to you to decide what you want to do in divided doses throughout the day. All I see are healthy babies being born. You know, Dr. Klenner back in the 1940s or 50s was doing IV vitamin C treatments on women during their pregnancy and then giving 10 grams intravenously before birth, and all he had was successful, good, normal births. And I've said before, and I talk about this in depth in my Sweden video and my New Zealand video, I show you the PubMed numbers, the medical literature showing that birth is a very, so you can tell it's not starting. Birth is
Do you need a tissue?
I'll get one in a second. Birth causes lots of oxidative stress. It's normal. It's one of the most stressful events in life. It's more stressful than a grown man having a heart attack when you look at the catecholamine levels. It's one of the most stressful things that can happen to a child. But then afterwards, all this anti-inflammatory programming comes from the mother, from breast milk, from the stem cells in the placenta, and everything's programmed to calm that stress down after birth. But what happens, if it doesn't all get neutralized, what's going to happen is the bilirubin levels rise. Why? Because God had plan B. Bilirubin is an anti-inflammatory substance. They're actually looking at using it for inflammatory disorders, bilirubin, okay? So that's God's plan B, to have that bilirubin level rise. What does the medical community do immediately? Put you under the blue light to lower the bilirubin. It's actually detrimental to do that to a baby. What's better is if the mother has enough antioxidants when that baby is born. They find that mothers with higher antioxidant levels, higher vitamin C levels, far less jaundice in that newborn baby. So you decide if it's safe for you in pregnancy. You have to do your own reading up, because I don't know your body. I haven't taken a history and done a medical examination on you, but in general, vitamin C is not only safe in pregnancy, it's necessary. And one of the talks I'm going to do this week is going to talk about epigenetics and how we wipe the slate clean when that new baby's genes are being formed in the mother and the father, the sperm and the egg. But if there's not enough vitamin C in those parents, that demethylation doesn't happen properly. So I'm going to talk about that. Vitamin C is not only safe, but it's necessary. So if you're not getting enough in your diet, then please think about supplementing. Use a natural form of vitamin C for that. I don't care. Just get some sort of vitamin C and understand why you're doing it. Don't take my word for it. Understand for yourself why you're doing it. Yes,
Can you OD on vitamin C?
I talk about that in my video also. You would need to take something like 11 pounds of... what they do is they look at the LD50 for overdose. A huge amount of snot just came out. Okay, I'm not going to show you. Take my word for it.
Okay.
So they look at the lethal dose. LD50 means the lethal dose where 50% of the animals tested die. I think that's what the LD50 is. If I'm wrong, just go look at my video. So what they find is that, there's so many drugs that are used commonly, over-the-counter medications that are used commonly that are so much more toxic as far as the LD50 than vitamin C. I mean, the reason vitamin C has been on the market despite not having a patent and despite the FDA wanting it off the market is because there's just nobody dying or really having any problems from it, especially when it's used properly. But you'd have to take, almost this entire thing. And no human being could tolerate that, because after a while the salt is just going to get to you. You're not going to be able to tolerate it. So it would have to be like a crazy situation. It's never happened. Dr. Cathcart gives 300,000 milligrams intravenously of vitamin C, of sodium ascorbate to people, and has no untoward effects. So you'd have a really hard time.
You gave some to Kent, has this really bad cough. And you gave some, you've been giving Kent, he hasn't coughed for us, have you?
I've been calling it his lemonade. So Kent, I'm like, Kent, here's your lemonade. I'm like, what lemonade? He drinks this lemonade. We haven't heard him cough in the past 2 days, and you heard him the other day coughing.
That stuff is actually delicious.
Yeah.
So you could drink as much of that and you're not really going to suffer?
No.
Okay, and Amanda McKay wants to know if it's good for her kidneys. Is that what you said, Amanda? I can read all these things.
Well, again, let's get back to the fetus, because that baby, it's so important for a growing fetus to have vitamin C. All I talked about was birth gestation. All I talked about was, fertilization. But in order for those cells to continue dividing and growing properly and lining up properly, if you don't have enough vitamin C, that baby doesn't have enough vitamin C, it will draw anything it can get out of the mother. And I talk about the levels of vitamin C in different parts of a growing baby, in the placenta, the cord, and the baby itself. And cells can't divide without vitamin C. So that's one of the reasons why a normal pregnancy needs vitamin C somehow. So as far as Amanda's question, is it good for your kidneys? It's good for every part of your body. The mitochondria work better when there's enough vitamin C. The detoxification systems work better when there's enough vitamin C. So how the kidneys come into play in terms of vitamin C is that you'll get very high levels in the blood initially after you take a dose, and then anything that's not taken up by the cells and recycled, cells have a way of recycling the vitamin C that's been used up and reactivating it. It'll be excreted into the urine, and then it'll be turned to oxalic acid after it's in the urine. So if you're dehydrated, you don't want to take massive amounts of vitamin C. You want to stay hydrated, because the amount of water in the urine will determine how much crystallization can happen in the urine. So it's good for all parts of the body. So it's not just kidneys, but it's good for everything.
So if you have a one gin too many, the next day you're probably going to be a bit dehydrated. So wouldn't it be good just to get a truckload of this down?
Absolutely. And the thing is, there are clinics that do something called a Myers cocktail, and they specialize in doing it for people with hangovers. They'll take 25 grams, which is 25,000 milligrams of sodium ascorbate, and then they'll add some magnesium and some vitamin B12 and folate to that, and infuse that intravenously. I personally don't think you need to go to that extreme, because you can get more steady dosing and you can get pretty good high levels just doing this stuff. And so I don't recommend that if someone's drinking, I don't recommend that people drink too much, but if they do and they have a hangover, but not to mention that alcohol causes oxidative stress, so you definitely want to do this if you are drinking.
And someone asked if they're a smoker, how much vitamin C would you recommend a day?
Well, from my research, every cigarette consumes about 25 milligrams of vitamin C. So you can do the math on that. And so smokers, even the FDA, who tells us we only need between 75 and 90 milligrams per day, which is a total joke, they acknowledge that if you're a smoker, you need more than that. But I'd say at 25 milligrams per cigarette at the minimum, over and above the 30 milligrams per kilogram per day.
Someone wants to know if they used it for abortions in the past. Vitamin C.
If anybody wants to find me that literature, I'm all ears. I say there's a mythical Russian article out there somewhere where supposedly high doses of vitamin C induced abortions. I'm completely unaware of that. In fact, I think if anything, it's going to keep the zygote.
Someone's saying rebound scurvy?
Intact.
Question mark. We don't know what that means. Pass.
And what about ascorbic acid? They say, can they substitute it?
Sorry?
Can they substitute the ascorbic acid?
Okay, so there are different kinds of ascorbate out there. You can take ascorbic acid, which is basically, think of it as hydrogen ascorbate, which is acidic, has a pH of about 5.5, or you can take sodium ascorbate, which is sodium ascorbate, has a pH of about 7. You can take calcium ascorbate, but I don't recommend that, even though it's the most available kind that you can find anywhere, called ester C, because as Dr. Tom Levy will tell you, he's a cardiologist. He shows medical literature that most of us are eating diets too high in calcium to start with, and the last thing we need to do, especially if we're mega dosing on vitamin C, is to be taking all that calcium. You can take magnesium ascorbate, potassium ascorbate. Those are a little more difficult to find. They're a little more expensive. Magnesium can cause diarrhea, so you have to be aware of that. But if you can find a blend that's got magnesium, potassium, and sodium, that would be perfectly fine.
Really random question. So don't answer if you don't want to. So for the military that have been forced vaccinated, is there any benefit in all of this for them?
Absolutely. And I talked about that the other day. It's like, I'm very loath to give advice on making vaccines go better, because I don't want anyone to take that the wrong way. But if you are forced to have a vaccine, you absolutely need to, what I would do is I would tank up on this 2 days in advance before the vaccine to getting those 2 loose bowel movements per day. You might be taking 10 grams a day easily in divided doses throughout the day. I would probably be taking liposomal also, 1 pack in the morning, 1 pack in the night. Before the vaccine, I would be taking a dose of, I'd probably be taking 3 packs of this before the vaccine. Then I would get the vaccine and continue with hydration, continue with this. You can even put some bentonite clay on the injection site, which can help with the, the soreness in the area. And absolutely you need vitamin C, probably along with a lot of, make sure your vitamin D levels are around 60 or 70 beforehand. Go get a blood test. If your vitamin D levels aren't high enough, I think that can also make the vaccine a little more harsh on your system, as any infection can be.
I feel so bad for the military.
I know.
It's shocking. Anyway, so
I will say that I have seen military personnel, once they've done basic training and all that, be able to get out of their annual flu shots based on past histories of having provable adverse effects. So it's not always a necessarily cut and dry situation that they have to have all vaccines every year.
Okay. Any more questions? There's lots of things about dose. How much should you give a child, how much a teenager, an adult? I mean, you've just basically said work it out yourselves. Yes?
Will it rot out your teeth?
No.
It's a random question.
I mean, the ascorbic acid, I don't recommend putting that right up against your teeth on a daily basis, but it'd be like sucking on a lemon, and dentists hate lemons, and that's why it's the ascorbic acid that can be kind of harsh on the teeth. But the sodium ascorbate, I mean, I've been known to brush with this stuff with a little bit of coconut oil and this and some peppermint. I'll brush with it, so no.
Anything? Do you know any of the? I mean, these are just really.
I will say, if you go by the gummies that have sugar and all this other crap in them, that will rot your teeth. And not only that, but one thing I didn't mention is that the transporters to get this stuff into your body is a 2-sodium 1-ascorbate transporter in the gut and in some cells in the body. And that's why taking sodium ascorbate, in my opinion, is physiologic. Now, you should know that there's also something called a GLUT transporter, G-L-U-T, and that's how we bring sugar into the cells. So if you have high sugar levels, if you're taking this with sugar, that's going to compete with the sodium ascorbate, and it's going to make it less useful in your body. It doesn't mean it's totally unuseful, but I don't recommend taking sugar ever unless it's in a whole form of sugar for a good reason. But definitely keep the sugars and the carbs low during an illness, because it will also compete with this.
So can you snort it, the vitamin C? Oh, I'm sorry, guys. Pose that question again, because something else came up and
I mean, so the questions that will it help shingles? So I presume it's going to help everything.
Any kind of infection, okay, that's why I want you to go watch my watch my video from Sweden, because all this stuff is addressed in there in the sense that your neutrophils, which are and macrophages, which are the main cells that fight infection, they don't move properly in the body. They don't digest the particles of gunk in the body as well if their vitamin C levels are low. And I've got all the medical literature to show that. I've got medical literature that shows if you give intravenous vitamin C to burn victims, their electrolyte requirements and fluid requirements go down, their infection rates are far lower. As far as asthma goes, if you've got allergic asthma, as I spoke the other day, that even conventional medical literature acknowledges that vitamin C is an antihistamine, and that's what we just noticed. That's what we saw in Kent just recently. He's got a histamine-mediated cough, and we gave him enough vitamin C, and it just stopped.
Is there a better time to take it, morning or evening?
I don't recommend taking it before bed, probably because I'm a nephrologist, and I know that overnight the urine concentrates. That's just it's basically one of God's other programs that keeps you from having to get up and pee all night long, so you can have a good night's sleep. So the urine concentrates, which means that the vitamin C will be concentrated more in the urine. So if you tend to be a stone former, you could potentially, and this is a very minimal risk, but I'm much more in favor of getting yourself up in the morning, getting hydrated, and then taking your vitamin C morning, afternoon, early evening, and not taking it just before bed.
With the high doses, is there a recommended dose for children?
The dosing for children is going to depend on any kind of chronic issues that they have, what their weight is, what their tolerance is. So what you have to do is just always start small. You can't go wrong by starting small, seeing how your kids tolerate it, seeing how their bellies tolerate it, seeing what the requirement is. I'll tell you that numerous parents have come to me saying that their kids are about to go into surgery. The surgeon wants to take the tonsils out. I'll tell you 100% of those kids have not needed surgery because we've gotten enough vitamin C into them, done the gargling with them, got their nutrition straightened out, got their vitamin D levels straightened out, and lo and behold, they don't need to have their tonsils taken out. So it's really important, any kind of infection or stress on the body, you're needing extra vitamin C because vitamin C is an antioxidant, which means that it donates electrons. What absorbs electrons? What uses up electrons in our lives? Radiation from the sun, stress from our thoughts, drugs from the pharmaceutical company, toxins that we're getting everywhere. So those are the kinds of things that most of us are exposed to. And while we can get some in our food and we can recycle some in our body, most of us need to keep replenishing with more electrons, and that's what this is all about.
That's really, that's really sad what you just said. So basically, loads of children end up having their tonsils out.
Still, to this day, they're taking out tonsils.
That's so. I mean, that's just the bloody men in the white coats again.
Well, it's kind of like, they basically, your immune system starts pretty much in your lips and your mucous membrane, but there's a big part of it right here, and they'll just take that out. So what happens later is they start getting infections down lower into the lungs later. So while it was ears and nose and throat, then the infections go down, and everyone celebrates because they got these nasty, gnarly tonsils removed. But interestingly enough, if you read the old medical literature where they were removing tonsils hand over fist, and sometimes even electively back in the 1950s, not only were the polio rates higher, it was a known inducer of poliomyelitis, but they found that so many of the tonsils that were removed, while they were ugly, they weren't necessarily infected. And ugly tonsils are not a reason to remove them because tonsils are just ugly organs especially when they're doing their job, especially in children. It's normal for children to have larger tonsils than adults. It's a normal part of growth up until I think around 6 years old.
Can formula-fed babies be given vitamin C, and when do you start?
First of all, I don't recommend formula. The only reason for formula is no friends and no breasts, okay? So if you can get donor milk, always try to get donor milk. If you can't get donor milk and for some reason you've had, breast surgery or you've got some reason you absolutely can't breastfeed and you have to use formula, I would probably go with the Weston Price formula that you can find on their website. But yes, because formula-fed baby's bowel flora is a completely different animal to a breastfed baby's bowel flora. Their endotoxin levels are much higher, and because of that, their oxidative stress levels are higher. So I recommend just a pinch. And Dr. Archie Kalokerinos from Australia actually showed this in the Aborigines who were dying because they were told formula was better than breast milk. He had them putting a pinch of sodium ascorbate into each bottle of milk, and it made a huge difference in the health of those young babies.
What about vitamin C to detoxify your body?
If you want to detoxify, vitamin C has to be part of the protocol. Anyone who understands detoxification, any doctor you work with, if they're not recommending vitamin C during a detox protocol, then they're probably not qualified to be doing what they're doing. Because when you're releasing, say you're doing a mercury detox or an aluminum detox, you're releasing that stuff. It doesn't just get released in the toilet bowl, it's also being brought into your system, and you want to be able to neutralize the oxidative stress in that with steady levels throughout the day. So just one IV treatment isn't enough. Add the oral vitamin C to the IV treatment.
Can you get this type of vitamin C in your food?
In your food, what you have is ascorbic acid with a lot of other cofactors and antioxidants that preserve that ascorbic acid. So yes, you can get this, but it's certainly not going to look like this. That's not where it comes from. I mean, it's not. I'm not making any bones about it. This is not natural. So if you want to go with a natural vitamin C, go get some rose hips, acerola, camu camu.
Kiwi.
Kiwi fruits are loaded with it. Parsley is loaded with it. Red peppers have 300 milligrams of natural vitamin C. That's huge.
Make sure you get organic though, people.
And the other thing is, it matters if it's sliced, the vitamin C levels start to drop immediately. After it's picked for the vine, the vitamin C levels start to drop. I go through all of this in my video. Please go watch the video.
Again, where can they watch it? Or should we just put it on We Are Vax, share it on We Are Vax or something?
Yeah, why don't you guys take it? You can watch the New Zealand one, which is quite good, on my YouTube page. And I believe other people have taken the Vimeo one, but it's out there. Just put in Suzanne Humphries, Orthomolecular Society, Stockholm, Sweden, vitamin C, and it will come up.
Do you recommend Dr. McCullough's liposomal C?
I've actually never tried it. I like Dr. McCullough. I like his products. I kind of like the fact that this comes in a sachet, but a lot of people like his because it comes in a capsule, and it's a lot easier for people to consume that way. For newborn babies and young babies, 2-week-old babies, that's the youngest I've ever treated a whooping cough case. This is what we used.
Okay, again, someone's still asking about shingles. Can it cure shingles? You just answered that anyway.
Yeah, I mean, shingles is a viral infection, so I'm not going to give you specific advice other than to say that, yes, it's something you definitely need. You know, when people are withdrawing from opiates and having chronic pain syndromes, they find that high levels of vitamin C brings the pain levels down. I have absolutely found that. All the oral surgery I've had, the vitamin C definitely brings the pain down. And pain is the worst side effect, aside from if you get it on your nose and you get optic nerve shingles. Pain is the worst part about shingles. But if you're getting shingles, I want to say this. Every case I've reviewed of shingles, if I look deep enough, I find some place where those people are immune compromised. So if you're getting shingles, you're immune compromised somehow, because that virus that's normally it's living in me right now, it's living in you guys right now. Why is it coming out and going to the skin? Because your immune system let it happen. So go through your life. Look at where you're possibly not getting enough sleep, where you're drinking too much, where your diet's terrible, where you're getting too many toxins in your food. Your thoughts, find where it is that you're stressing yourself out and deal with it, because otherwise you're just going to get it again. Even if you get vaccinated, all the vaccine is like a 4 times high concentrated dose of the chickenpox vaccine.
Is there soy in the liposomal?
Yes, there's soy in this. So that's one of the caveats, is if you've got a soy allergy, then this is not for you. But they do make a sunflower lecithin form of this, and go ahead and try it and use it if you want a liposomal form. Again, this is what I use in kids and adults that have whooping cough, and I can't mess around testing out other forms when I know I have something that works. But I have had other people use the soy lecithin, and it does a perfectly fine job for everything else, and probably would be perfectly fine during whooping cough.
Wonderful. Anybody else? Got anything else, or are we good? Anu, happy?
Always.
People want to know about making your own. I'll tell you that I spent about 48 hours a few years ago experimenting in my own kitchen. I made a total mess out of everything. I tried all the different pHs. I used bicarbonate. I used the blender. I used different recipes that I saw in different places. I wasn't able to get it to gelatinize, and I don't believe that it's really fully liposomed if you don't get it gelatinized, and I don't know if it's how liposomed it is. So go ahead and make your own liposomal vitamin C at home if you want to. There's no harm in it. The only downside is that you may only have a 25% liposome cocktail. You may have 50 or 75%, where this is like 99% liposomed vitamin C.
All right.
And that will be that.
That will be that. Okay, well, we may come back on later, because seeing as we persuaded Sheila to stay for the evening,
Yes.
I think we may come on later and have a chat. That was very fascinating. Fascinating. I absolutely love this, and you've ordered some for us to take on the bus, haven't you?
Yes.
Fantastic.
Oh,
it's
one
so
more
yummy.
question.
It's like sweeties.
Does it help with cavities?
You know, cavities are a complicated thing, because cavities are, basically a result. Let me talk about cavities for a second, because it's not just a yes or no kind of thing. What happens when your teeth are rotting is it's a combination of the diet not being optimized, your mineral content not being ideal. And what happens, people think that when you eat sugar, it's a direct effect upon the teeth. And so there was this really interesting experiment where they took laboratory rats and they injected them with sugar. And guess what? They still got cavities to the same degree that the rats that were eating sugar got them. The reason being is that teeth are alive. They have tubules with flow of fluid in them. A healthy state for a tooth is that the tubular flow is from inside to outside. When that happens, the sugar and the gunk and the bacteria aren't being pulled into the tooth. When you eat sugar, it reverses the tubular flow of that tooth, whether it's healthy sugar or not. So again, all these people that tell me their kids have cavities, their diets are great, when I go sit down and talk to them, there's always something. I mean, maybe there's some people that's not the case, but for most people who are developing cavities, there's either going to be too many carbs, brushing not good enough, mineral content's not good enough, they're not taking bone broth, they're not getting the essential fatty acids that they need. It's going to be something like that. But yes, I mean, vitamin C is part of the immune system, again, and it's antibacterial. So if you're putting vitamin C into your mouth, swishing it around a little bit, that's only going to be doing good. Vitamin C also is used in the sausage making industry, which is really interesting. Sodium ascorbate is used to make fermenting in sausage. The reason being that the E. coli and the nasty bacteria dies in the face of it, and the probiotics tend to do much better in the face of it. So again, you're going to be promoting the beneficial bacteria in your mouth. In my opinion, I don't have any medical literature to support that, but in my opinion, you're going to be supporting the beneficial bacteria in the mouth by using vitamin C.
Can you give probiotics right after vitamin C?
I don't see why not. The one thing you don't want to do with vitamin C is take iodine at the same time. It's not that it would kill you or cause any problems, but the vitamin C will inactivate the iodine. So you want to wait like an hour between dosing vitamin C and iodine.
All right, well, I think what we'll do is come on either a bit later or in the morning, and people can have some more questions answered then. Thank you so much, Dr. Suzanne. Everyone loves you.
Thank you, Dr.
Bye-bye,
Suzanne. Bye-bye, we are vaxxed.